Are you a chiropractor with a struggling practice, having a hard time finding and keeping patients? Is your staff falling short of expectations? I'm Dr. Scott Sawyer, and DC Trainings has the answers that you need. So tune in now and find out how. Hello, everybody. Welcome to DC Trainings. Today is a great day to talk about chiropractic and to specifically dive into more ways that you can maintain a successful practice and enjoy taking care of all the patients that you take care of, myself included. It is it's an honor and a privilege to be able to help people anywhere we are in the world with our hands, with adjusting the people that need our help, and clearing out any subluxations that are not allowing those individuals to enjoy their health and a maximum quality of life. So I've worn this shirt before, but I thought it would be worth repeating because this is the famous quote by Louis Pasteur, you could see here, where he says, "The germ is nothing, the terrain is everything." And through chiropractic, we help our patients to enhance their terrain, meaning their bodies, so that their health is at an optimum level. And that way, when we come in contact with germs or bugs or bacteria or viruses or anything, we don't have to be overly concerned because we know that our defenses are strong. So I just thought that would be a great way to start our time today to share that quote. And with that, let's dive right into our topic today, which is going to be on primary concern. To frame this in the sequence, last week we talked about the consultation details, and that was where we really gather a whole list of potential symptoms or health challenges that our patient is suffering with. And in those challenges now, since we have that list, we want to further fine-tune this or funnel this into what ultimately will be the primary concerns. Now, those two sections are building on the second week, which was subluxation education, and then also building on the memorable welcome. So how do we go through that? We made a great first impression with the memorable welcome. We then educated our new patient about what subluxations are and how we can address those subluxations through chiropractic care. Now, I don't know if you're a straight subluxation-based chiropractor or you practice some other form of chiropractic. I know there's a lot in our scope that we can use. In my practice, I'm focused on being a subluxation-based chiropractor, which means that my whole education process is really funneled into one condition, and how removing that one condition or stabilizing that one condition then has this exponentially big impact or effect, or positive impact or effect on a person's health and well-being. And what I've found is by really emphasizing that one condition, it really helps patients to take better control of their health, because when they understand the benefit of having a subluxation-free nervous system and how that impacts their diet, not their diet, but their digestion, their energy levels, all the different aspects of their health, it helps them to make more intelligent decisions about how they're going to take care of themselves, and obviously incorporate chiropractic into those decisions. So as we go through this flow, hopefully you're seeing this process happen with your patients. You're seeing them become more intelligent about taking care of themselves in a healthy way, and not waiting for disease to set in and then treating it with drugs or pharmaceutical products, but really being empowered to maintain optimum health, and then combining that with one of the most important organ in the body, or one of the strongest aspects of healthcare, which is to have a strong, healthy nervous system. So that's this process that we're going through in terms of allowing you to enhance the sequences and systems inside your practice, but also emphasizing to your patients these benefits that we're offering them. So it's really exciting to go through this process. I know I always say that this is one of my favorite sections in DC Trainings, but I really enjoy this process because and for those of you who've been training, coming to DC Trainings for a while, that it's like the blinders come off. You have a person that comes in and they're like, yeah, take care of my back pain. I'm here. I just need relief from my back pain. But then when they start to incorporate what we're teaching them, or they start to understand what's possible it's like, well, I'm not just going to just settle for no back pain. I want enhanced health. I want to continue playing golf into my 80s. I actually was just skiing last week with a couple who's 78 years old. They're both the same age, a beautiful couple. They've been married for over 50 years. They're both getting way up there. They're in their late 70s. I think they said 78 or 79, and both skiing, and they were skiing good. And so I started talking to them about chiropractic, and they've both been under chiropractic care for many, many years and love chiropractic and attribute that to be part of how they're able to be skiing. And again, these people, this couple is in their late 70s. So when we start to turn the light on with what's possible with somebody's health, and how if we can, all of us, patients and doctors included, CAs included, I know there's CAs on our call today, but when we start to empower people with this knowledge that we can enjoy a quality of life that is high level, and it's not just the absence of disease or the absence of symptoms that dictates how healthy you are, we really start to get patients that value what we do in a way that it doesn't take a lot to say. And I just had earlier this week, I just had a really great care plan renewal with a patient, and it's a husband and wife actually, but I was talking to the husband specifically, and they just completed their first care plan. And in DC trainings, this is a 12-month care plan. So this is not a short, let's take care of you for what your insurance covers or the corrective care. Sorry about the beeping in the background. There's some tractors working outside my office today, but it's not just that short vision. It's the whole year, which is corrective care plus wellness care combined into a care plan. Let me stop the share here. There we go. So it was so easy when I was talking to them about continuing their care beyond their first care plan. It was just simple, because what came from that was me saying, how would you like to continue? And they both just instantly said, yes, we want to continue. Okay, great. Are you happy with your current schedule? Yes, we are. And they've been coming in weekly. Yeah, yes, we are. Okay, great. I agree with you. I think that's a great schedule. I myself get adjusted every week. I have been now for 33 years. I've been getting adjusted regularly, sometimes more than once a week. But anyways, they both were just instantly saying, yes, that's what we want. We're excited and we want to continue. Now, how's that for a report of findings, right? I mean, I know it's not the first report of findings, but it's the report of findings where we say, are you happy with what we've been doing? Are you happy with what we've taught you? Are you happy with what you've learned? Are you happy with what you've received? And would you like to continue that in the future? And that's about the easiest care plan renewal, or the easiest report of findings, when a patient has been given the knowledge and the information to make an informed decision about how they want to proceed with their care, right? I mean, that pretty much just launches us right into, let's start to really show you how to dial this in so that your patients can really get it. Okay, so let me jump back over and show you the way that this works. So, and actually, let me just open that window up one more time. Okay, so let's move into this. So we've got our primary concerns, and essentially what we want to do from here is to, as I said, funnel this longer list of potential symptoms into what is the most motivating components of what your patient wants to achieve. Okay, so here's an example of this. Actually, let me move this out of the way for you. There we go. Okay, so here's an example of this. This is from our consultation details form, which we've taken that whole list of symptoms, and now we've combined it into three, right? There's three here. There's lower back pain, allergies, and indigestion. And then down here, there's the daily activities that are affected. So, well, let me continue on. And one thing that's really important is just to note, you want to really show empathy here. And this is something that I have trained with my team on, like literally we role play empathy. And I know, sometimes it just comes naturally for us. Some of us, I should say it this way. Some of us, it comes more naturally for, but sometimes it takes practice. And there's subtle things about this. And I'll give you an example. Let's say that somebody has really bad headaches, and that's what brought them in to see you. And the headaches are so bad that they're taking medication almost on a daily basis to deal with those headaches. So when they say to me, oh, I've had these headaches, and I say, well, I understand. How do they affect you, say, when you're at work? And the patient says, oh, it's so hard to concentrate. And oftentimes I leave work early because it's just hurting so bad. I go home. Now, if I'm the typical, I don't want to stereotype too much, but the typical doctor's office, maybe it's a doctor's assistant or the doctor themselves, that's trying to get this information dialed in so they can then proceed with taking care of this patient, I might respond with something like this. And I'm going to stop my share again. I might say, so the patient says, oh, it's hurting me so bad, so I can't concentrate at work. I sometimes leave work early. Okay. And what else? Now, that is not, in my opinion, that is not sincere empathy, because I'm incorporating the information, I'm soaking it in, I'm absorbing it, I'm understanding it, and then I'm pausing to write it down. But there's a common comment that's made that's, maybe it's usual kind of standard conversational statements like this that we need to remove from our vocabulary. And that is to say, okay, when something is not okay. So to share that with you as far as empathy goes, when somebody says to me, oh, it's hurting so bad, I mean, I have to leave work early, it's hard to concentrate, I take medication. Wow, I am so sorry to hear that. That's terrible. That's one comment. Or I might say, thank you so much for sharing that with me. That is not normal. That's another way. Another way might be if I'm the doctor's assistant, say I'm a CA taking notes, I might say, well, I'll be sure to share that with the doctor, but we've had other patients tell us the same thing. The good news is we've been able to help them. See, what I'm not saying is, okay, what else? Okay. And that's kind of a conversational standard. But in this setting where we want to show empathy and we want it to really come across in a sincere way, that's tactically not appropriate for this situation, right? I mean, it can come across without raising any eyebrows. The patient may not even notice. But in general, in this situation or this setting, we wouldn't want to say it in that way. Okay, so sincere empathy is really important. Another thing I'll add too is sit knee to knee, right? If you're doing a consultation with a patient who's sharing these real deep-seated, struggling, suffering types of symptoms, let's sit knee to knee with them. Let's really show that empathy. Let's be up close. Let's lean forward. That's another way. So these are things you should be taking notes on in terms of training with your team to show empathy. So if I'm leaning back in my chair and I'm saying, oh, I understand, that's a lot different than if I lean forward and say, wow, I understand, right? So leaning forward, having eye contact, not having to stop and write things down in the middle of when somebody's sharing that with you. Even worse, what if they were talking and it really got deep and you were listening and then you went to write it down and you went, oh, wait a minute, can you repeat that again? You lose the effect of that empathy. So anyways, just wanted to elaborate on that. Now let's keep going and practice that with your team, not to belabor that too much, but practice that so that you understand when you're in your consultation, meet with your team and say, how does this feel for you? If I'm sitting here and imagine you were sharing something that was really, you were really sharing how much you've been suffering with something, would you feel like I really care if I sit over here versus over here? Or would you really not feel like I'm connecting with you if I was like across the desk or if I was over here this way? So look at your room in terms of where these conversations are happening and make sure that you can express that empathy in that environment as well as in your body language and your demeanor. We're going to prioritize the top 3 concerns. Now, I just want to kind of emphasize this because from last week, we had the consultation details webinar, and that's where we gathered a long list, right? It was the original chief complaint. That's the concern that brought the patient in to see you. That's originally what they presented to your office with. And then we added to that the associated symptoms, right? We went through a nerve chart, which I showed you. You can go back and listen to this on the recorded webinar if you want. So if you weren't able to listen to that, just go to the website, check it out. But there was the long list. And at the end of that sequence, that long list of their chief complaint and the associated symptoms or related symptoms, we then summarized that, right? We summarized it in a way where we read that all back to them. And it might have been 2 or 3 things, but if you've done your job right, and the patient actually has other things, you'll uncover all of them. And sometimes it can be quite a list. For those of you who've experienced this, it can be quite a long list. In fact, I see Celeste on our call today. So welcome to the call today, Celeste. You're I'd say a veteran CA. You've been a CA for a long time. So so you know, right? When somebody really starts sharing with you and they start understanding that the nervous system can express problems in so many ways, right? The patient starts saying things like, I know I came in for the back pain, but do you think that these allergies might be related? Do you think that the digestive problems I've been having might be related? Do you think that the problems with infertility or impotence or sleeping problems or thyroid issues or mental fogginess? I mean, the list can go on and on and on. And all these things start coming out because the patient's thinking of possibilities, right? They're starting to expand this possibility idea. And so we get this long list. And we then read it back to them to make sure it's accurate. And once we've read it back to them and they say, yeah, that is, boy, all those things. I know I just came in for this one thing, but now that you say it, I've really had problems with all those things. And they may have been smaller problems. We don't have to make them bigger than they are. They may have been bigger problems. But now's where it gets to be a little more in depth. And the reason why I say it in that way is because when you really ask a patient to prioritize the top 3, that's when they start getting that possibility thinking like, wow, if I could, maybe you could help me with that. That would be amazing. I didn't know that chiropractic care could help with that. I didn't know that that was a function of the nervous system, but now that you're saying that, that would be awesome if you could help me with that. So there's these comments that come in that where you really start to see that in the patient. You start to say, wow, they're getting it, right? And again, kind of going back to when I was complimenting Celeste, who's been a CA for a long time, Celeste doesn't have the training that a doctor has, and that's fine. To give our CAs the opportunity to experience what it's like to truly help somebody, not just in terms of moving the bone, but in terms of education, is a powerful motivator. And CAs like Celeste have chosen to make chiropractic a career decision based on that. And I know my team would echo the same thing. Like, they love coming to work. And a big part of coming to work is seeing people's lives transformed for the better through chiropractic care. That's a huge, huge motivator to get up and come to work in the morning. Okay, so let's keep going. We're going to obtain the effects on lifestyle. And I'm going to read you a script in a minute that kind of follows this process. So obtaining the effects is where, if you want to have more retention with your patients, if you're seeing sort of a revolving door where you have new patients coming in, they get some adjustments, they feel better, and then they leave, and you want to change that, we're going to get into how to change that. This is really where you, I was saying this on the seminar, but the longer the list of effects, the easier the report of findings. Okay, so, and again, I don't want to make something out of nothing. I'm not trying to make stuff up, but what you'll find is when you ask the right questions, you'll get answers that really start to show when somebody is suffering in terms of several areas of their health capacity. So write this down. The longer the list of effects, the easier the report of findings. Okay, and you're building retention. But the longer the list of effects, the easier the report of findings. And when I say report of findings, that's not just saying, hey, let's see you for a few adjustments until your pain's gone. That's sitting down with somebody, explaining what's going on, and then saying, this is going to take not just an initial course of care, but this is going to take maintaining that on an ongoing basis so that you can stay healthy. Because one thing I can almost assure you is that you're going to come to enjoy being healthier than you are right now. That's just one of the benefits of having a spine that's free of subluxations, or at least the subluxations are stable. So you're going to enjoy that. And from that, most of our patients choose to continue on after that, not only for wellness care, but really it's more for supportive care. We're supporting the changes that we've made so they don't revert back in that downwards trend, right? So I'm kind of explaining this in more detail to motivate you, everyone on our call today, to really dive in and make sure you get that accurate list when you're going through this with your patients. So let's jump back over. So we're going to obtain the effects on lifestyle in a way, and I'll show you that in just a minute, but if you want to write this down, there's 3 areas that we're going to ask questions about. So when we say the effects on lifestyle, and you say, well, what lifestyle? What do you mean? What I mean is, how is this affecting you at home, at work, and with your hobbies? Home, work, hobbies. So write that down. Those are the 3 areas that we're going to ask about when we get into the details. So once we've obtained that, right? So now we have those effects and they're listed out. They're actually written down. Then we're gonna do a little sidebar, a tangent for a second. And it's not an unrelated tangent, although it may seem like that at the beginning. So it would look something like this. Have you had any, just to ask you some more questions, is there currently any prescription medication that you're taking, or any over-the-counter medication, anything at all? And we're going to give examples in that question too. And I'll tell you why first, and then I'll tell you how it goes. So the reason why is because many times when patients get into a routine of taking medication and being, unfortunately, pharmaceutically dependent, that becomes so routine that they don't even think about it as abnormal anymore, right? And this is kind of a case in point, but I know for some of us, I'm sure, Dr. Robinson, you've experienced this, where you say, do you take any medications? No, I don't. How about blood pressure? Oh yeah, well, I take that. You ever take any springtime allergy meds? Oh yeah, I take Sudafed in the spring all the time. Oh, so and I'm sorry, I'm being sarcastic with this when I smile because it's not funny, but they just said they don't take any medication, and yet they're taking daily blood pressure medication and seasonal allergy medication every year. They're on medication, right? I mean, that's how it is. But because they've become accustomed to it, and because it's so routine, it's almost thought of as not even an abnormal thing anymore. But the beauty of chiropractic care, once again, when your nervous system is functioning at its fullest capacity, and when your body starts to operate at a level of health that's normal, not average, but normal, there's a big difference between normal and average sometimes, then those symptoms fade away, right? And they become abnormal when they present themselves on an occasional basis. So that's why we want to ask these questions. And I was saying, I'm going to show you this in the script in a minute, but I'm pointing it out now ahead of time because we want to make sure that we ask these questions. And the beauty of it is when somebody's health improves to the level where they don't need those medications anymore, then who's going to get credit for that? Chiropractic's going to get credit. You're going to get credit, but bigger picture is chiropractic's going to get credit for that because they'll attribute the chiropractic to producing that result. If we didn't ask the question and those symptoms and health challenges just faded quietly into the distance, they would, a patient might think one day, oh yeah, that's right. Years ago, I used to have those allergies. I forgot all about that. Or, oh yeah, I used to have debilitating migraine headaches that I had to take Tylenol every day for, just so I could go to work. Yeah, I forgot about that too. It's gone, So we want to make sure that we document it now, not just for the benefit of having accurate records, which we need to do, but also for the benefit of reminding the patient later on, hey, before you were under chiropractic care, remember when, ... right? So that's why we don't want to lose sight of those things. Okay, so let's keep going. And again, I'll show you this in the script in a minute. One last safety net is to ask the patient if there's any missing information. And I guess the best way to share this aspect of this process is in my own office, because I have 3 CAs who all do the new patient consultation. They all help me out. And as I said last week, technically, if we're going to define this in black and white, a CA cannot do a consultation. They can only do an intake, a health history or an intake. They can't do a consultation because by definition, consultation incorporates the doctor's interpretation of the information that was shared. So I'm using the consultation term in a general way today, as it relates to the the CA being able to participate in that process. So not to get too deep into the weeds on that, but that's just a technical description or definition there. Okay, so anyway, so incorporating this, I have my team helping me, right? They're doing these consultations. They're asking about health information. And I would hate for them to miss something that was important and relevant to how I take care of a patient. So as a safety net at the end, we want to ask, now, given everything I've covered, is there anything I've left out? And what's important about this is that the more a patient becomes aware of what's going on, the more that can bring to light these more subtle things that maybe your CA forgot to ask about. Not intentionally, maybe they're a new CA, they're just learning the consultation, but I need to know that the questions were asked. And that way, as the doctor who's going to interpret these findings, I can dive in deeper as needed. So I'll show you that in just a minute as well. All right. But that's the flow of how this goes. So this is now the third and final series of written notes. And remember, the first one was based on the chief complaint and chiropractic care, or impressions of chiropractic care. That was the first one. The second one was the associated symptoms. So we're adding in any other symptoms or health problems that they've had as it relates to their spine, their nervous system. So we have the chief complaint, we have the related symptoms, and now the third part where we're writing it down is incorporating the primary concerns and all the effects, along with medications or surgery. I forgot to dive in on that on the surgery. So let me add that part for you as well, because with the surgeries, we want to know if they've had surgery. Now, here's an example of that. Let's say that a patient is coming in for headaches, and in addition to the headaches, you uncover that they've had chronic sinus trouble and they've had sinus problems. And so obviously our plan is to correct any subluxations, perhaps in the cervical spine, to enhance the nerve flow into their sinuses, their glands, their important parts of their immune system. And through doing so, we hope to enhance their health to a point where the allergies fade away and their body is healthy enough to where it doesn't overreact when they're exposed to pollens or whatever the allergens were. Given that scenario, in the process of the consultation, we find out they had their tonsils removed. Now, surgically, that was done historically a lot more often than it's done today. Doctors have learned and they've improved on which surgeries are necessary and which ones are maybe unnecessary. But in the process of our consultation, we find out that they don't have their tonsils anymore. So what does that do now to their susceptibility through their immune system to allergens and pollens? Obviously, it increases it. So if I were in a doctor's shoes and I found out that, and let me stop the share again. I found out that here I have a patient who's looking for an enhanced immune function. They're looking for enhanced sinus function. They're looking for all of those things to improve so that they no longer get headaches. And I know I'm paraphrasing this. That's not how they came in and told us they want us to do it. But going back through the pathway of the nervous system and how we approach these types of healthcare problems chiropractically, we're not treating conditions. We're actually enhancing the body's function so that symptoms oftentimes fade away, right? So in the process of doing this, I'm going to let that patient know, because of the fact that you are not operating with a full deck anymore, right? Because your part of your immune system has been removed. Your glands have been taken out of your body. Your immune system is never going to be fully functional as it was intended. Now, it doesn't mean you're going to suffer for the rest of your life. It doesn't mean you're doomed and you've got a cloud over your head. All it means is that we're going to work with what we have in the best way that we can. And given the situation, wouldn't you agree that your body needs a nervous system that's functioning at its best to give you the best opportunity to enjoy the quality of life that I think you deserve, albeit with part of your immune system having been removed from the equation? So again, we can approach this from a chiropractic standpoint to enhance overall function for this individual, and at the same time recommend, and we're going to get into this in module 3, so we'll come back to this in the report of findings, but recommend ongoing chiropractic care literally for the rest of their life to maintain that new level of function. And what's great about that is when you explain it in those simple terms, a lot of patients, in fact, most, but many, many patients are going to say, sign me up. Just like the couple I told you about this week, where I said, you want to continue? Oh yeah, we do. Right. And it comes through this education and through an understanding that we're providing. Now, I know that the whole sequence right now is on the new patient sequence, and we're really obtaining information. That's how it's viewed, in our education and in the overall practice parameters. Is like, okay, a new patient comes in and you're obtaining information. You're not yet providing care. But in my mind, providing care also includes education, doesn't it? If we're educating somebody, technically, yes, we're providing care. And it doesn't have to be a one-way street on the first visit. The first visit can definitely be a two-way street where we're providing education and at the same time we're obtaining information, and then we go forward from there. And you'll see all of this really start to connect. You'll connect all the dots in the report of findings. You're going to see how this all comes together. All the things that we're doing right now are building up to a successful report of findings where your patients decide to enjoy lifetime care. And I know there's a couple new docs on the call today, so I want to share this with you because this is one of our taglines in DC trainings, which is lifetime care, 1 year at a time. Lifetime care, 1 year at a time. And I can say that with full confidence because I know that the systems in DC trainings will help you to produce that in your practice, right? Because our practice is a business. We have to have patients coming in, paying money, and that's how you pay your bills, and that's how you make a living. But with the business side put aside for a moment, this is about educating people to make informed decisions about their health. And when you provide the best information or the best education, starting from day one, you're going to see a much higher retention rate with your patients. So pretty exciting. So let's go through this. Well, actually, let me just finish this out because we're gonna finish out this little part, but then I'll get into the website and I'll show you the script. Okay, so before the CA exits, now that this information has all been gathered and it's been written down, we're going to repeat back to them the primary concerns and effects for accuracy. Okay, so just make sure that that's all accurate because, again, from the doctor's standpoint, when I come walking in, I need to know that the information I'm reading in that file has been obtained accurately. And CAs, don't worry. If you're a new CA and you're thinking, I'm not sure I want to actually have this much responsibility because what if I miss something and then the patient's health is jeopardized? I understand. Don't worry. It's all going to come out. Nothing will be missed. You're going to get everything. And if something was missed, we have these safety nets built in so that we won't miss those things. Okay. So, oops, I'm sorry. And I need to share my screen. I'm moving forward without sharing it. Okay. So with that, we're going to repeat the primary concerns and effects for accuracy. So it'll be repeated back to the patient so they can say, yes, all of those primary concerns are correct. And all those effects that they're having on me, that's correct too, right? And I'm paraphrasing. Of course, the funny part about that is that our patients usually don't follow their side of the script, but that's okay. Okay, so then the parting comment is it sounds like a subluxation, but the doctor will decide. Okay, so all this information, when it's been gathered by our chiropractic assistant or our chiropractic advocate, remember that a CA cannot determine a subluxation, right? They can't decide, yes, this is a subluxation or it's not. But what they can do is they can instill a sense of authority and a sense of experience. Actually, it would be a sense of authority through their own experience, whether that's experience. If you're a new CA, that means you're still training. That's experience. Whether you're a longtime veteran CA like Celeste, that's obviously experience too. So either way, that voice of experience needs to come through right now from your CA saying, it does sound like a subluxation, but the doctor's going to come in and determine for sure. Now, I want to just share with you what kind of a paradigm shift that creates for you, right? When a patient comes in, they're expecting, and not always, I know, but many times they're expecting pain relief, right? I need you to help me with my pain. That's one paradigm. And a paradigm, if you're unfamiliar with that, is a way of thinking. So that's one way of thinking. To go through a paradigm shift and move over to a new way of thinking means I went from I want back pain. I want my back pain to go away. I want you to treat me, and I want you to help me with the back pain so I can be on my way. to think about what the new paradigm that's in their mind is, which is, I hope I have a subluxation. Wow. I mean, that right there. I could just stop there and say, wow. But it goes further. I hope I have a subluxation. Why? Because if I have a subluxation, then this office can accept me as a patient, which means they'll take care of me, which means what do I have now? I have hope. And hope is a powerful word, right? Think about the pharmaceutical approach to healthcare right now. And I have great friends that are medical doctors. So this is not a bash on MDs or the medical profession, but I do have issues with the pharmaceutical companies because the whole perception from the general public and the marketing that's put in place to promote this is, I've lost hope in my body's ability to be healthy. I've lost hope in myself. I am not healthy, and there's nothing I can do about it. So the unfortunate approach that's used by the pharmaceutical industry right now is to remove hope from people and leave them as sitting ducks to their own circumstances, their own environment. That's why I wanted to share this shirt with you today, right? The germ is nothing. The terrain is everything. But if you flip that around and you think about the marketing that goes into our society through the pharmaceutical industry, they would say the germ is everything and the terrain is nothing. That's what they would say. Why? Because if you have no hope in your body's ability to maintain health, that makes you a lifetime dependent, pharmaceutically dependent customer on their industry. And the irony of that is, if you ask any patient, and I ask this every month when I do my spinal care class, my orientation, every month I start out my class by saying, how many of you want to take more drugs? And I always look around the room and then I comment and I say, well, that's funny. Nobody ever raises their hand when I say that. And yet, if this was a group of pharmaceutical reps, and I ask the pharmaceutical reps, how many of you want more people to take more drugs? Every hand goes up. And it does in my class. I say, just play this out with me, follow along, bear with me, and then I'll bring it in for a landing. All their hands go up. That's right. Now, do you see the contradiction there? We have an industry that's promoting sickness. And yes, it's obvious, and that's why nobody wants it, but they've left us no options and they've removed our hope. And as a result of that, to their profitability and to their great joy, the more of us that become pharmaceutically dependent, the better. Now, in chiropractic, we stand for something different, don't we? We're going to change that. We are changing that. Actually, we have changed that. We operate in a different paradigm. So the paradigm for us is to give our patients hope, which means that when we leave this consultation and we say, it sounds like a subluxation, all of a sudden, our patients are happy about that. They're happy. Why? Not because they have a subluxation. No, that's not a reason to be happy. They're happy because we're giving them hope. And in the average scenario, that doesn't exist. So it's really a very exciting opportunity that we have when we go through these steps in the way I'm showing you with our new patient. It's a very exciting opportunity. Okay, so let's keep going. And then actually, and I keep saying I'm going to jump over the website, but I'm having too much fun with this, and you're a great audience. Nobody's even complaining about no hands going up. I'm kidding. Anyways, let's keep going. So the information that's gathered for the doctor is the primary concerns, the original cause and duration, and the effects on lifestyle. Now, it says the entire consultation is roughly about 10 minutes. Sometimes it goes longer. If the patient has a longer list of effects on their lifestyle, or they need more time, to share those details, maybe there's they get emotional and there's more empathy that's needed, that's okay. The consultation might go longer. But sometimes, as in the case I had a new patient this week, the consultation was very short. They had one area, it was really affecting them. My CA gathered the information quickly. It just lasted a couple minutes, really, and then they were ready for me. So it could go faster, it could go slower, depending on what your patient's needs are. But roughly, we say it's about 10 minutes. And those are the three things. And as long as it takes together those three things, we're home free, right? So CAs and doctors, if you're doing the consultation, ask yourself, did I establish a primary concern with a duration of greater than 1 year with all major effects? Okay, now when I say all, once again, I'm not trying to dig for things that don't exist. I'm not trying to make something bigger than it actually is. I just want to make sure that we're thorough so that nothing gets missed or glossed over that could then potentially respond to chiropractic care in a positive way and not receive recognition. That's what I want to make sure of. We want to make sure we recognize those areas of health that have improved and then give credit where credit's due. Now, when primary consultations and effects are described clearly, the patient's understanding improves. They can make more educated decisions about their healthcare. They can become more proactive about their healthcare. And the report of findings will become easier when the primary concerns and effects are obtained accurately and completely. So we want to make sure we don't gloss over any of these steps, incorporate this in a way. And again, it doesn't take a lot of time. Obviously, we're spending more time on it now, and you'll spend more time on it when you're training in your office with your team, which I want to remind you, make sure you're doing that. It's about an hour a week that you spend in training. That's not too much, but that training will pay off in large amounts with better retention, better educated patients coming in for lifetime care, 1 year at a time, and all of those things that I talked about earlier. Okay, so then now the CA leaves the file outside the room for the doctor. So doctor, your new patient is ready. The doctor's notified that the new patient is ready, like I just said. Sorry, I've been a little redundant there. And then next week we'll move into the exam process. Okay, so let me just stop the share here and let's jump over to the website for a couple of minutes while we wrap up. This is a good time to ask if you have any questions, but let me just jump over to here. So this is our weekly topics on the website. We have 2 documents here, the primary concerns script and the primary concerns sample. And I want to thank all of you for your input. We've had emails come in with questions, which actually, sorry, I printed one of those out before I started today because I wanted to read it to you. So I'll come back to that in just a moment. But thank you for emailing your questions in. This document that I'm showing on the screen here, the primary concerns sample, is one of those such requests that one of our members requested it. We put it together, and then here you go. There's also a demonstration on the website, and this is an excerpt from a consultation of me with a new patient going through and gathering the primary concerns. So it's only a minute long. It's just that one piece, but you can, you can watch that to see actually how that takes place in the process. And I also, one of the things that I shared in this video was really that empathy. You can see I'm kind of leaning forward. I'm not behind a desk. I have, well, hopefully she's acting the part. This is my CA, but I have a very concerned patient, new patient, who's sharing these details with me. So you can watch that. And then as far as these, the script, I want to go through this with you because this is what you'll be training on. So you're going to want to get together with your team and role play this back and forth, and talk about, did we get the empathy in there? Was the concern really shown? How did we feel with that environment, in terms of how a new patient would feel, right? So, okay, here, review of symptoms. You've had low back pain radiating into your left hip for about 5 years. You've also had frequent migraine headaches and allergies. These are definitely not normal symptoms. And then we want to establish our primary concerns. So that was the long list of symptoms. If you were able to pick one of these health problems and have it never come back, which one of those would it be? Well, the lower back pain. Thank you. What would you choose for number 2? Headaches. Thank you. What would you choose for number 3? Allergies. Thank you for sharing these details with me. Now, in here, I didn't really get into a lot of empathy because I'm just creating my list and I want to keep the flow moving, but we now have our priorities, don't we? We have our 1, 2, and 3 priorities from the list, and then we move on. When these problems are at their worst, how do they affect your lifestyle at home? That's the first one. Well, at home, I can't enjoy any relaxation because I'm always in pain. I'm sorry to hear that. How do they affect you at work? That's number 2. At work, I'm unable to focus or be productive like I should. I also must take pills to deal with the pain. Oh, ouch, or that's unfortunate, right? I'm not saying, oh, okay, and then writing. No, I'm really emphasizing my empathy with these subtle comments, but they, again, inform the patient in not so many words that this is not okay to have these things going on like this. How do they affect your hobbies or leisure activities? Well, I can't enjoy any activities anymore. I cannot enjoy any activities anymore because I can't go outside without getting allergies or a headache. These problems really affect me in a lot of ways. This is not okay. You've been affected in a lot of ways, and I hope we can help you. And then we repeat the primary concerns to prepare for the third series of written notes. Remember, this is the third series, right? The first one was the chief complaint and the chiropractic impressions of chiropractic. The second one was the list of all the symptoms. And then this is the third one. So then I'm going to take a minute to write this down. Is there anything that I missed or I left out, right? I told you that's your catch-all. So for the CAs doing these consultations, just know this is the part where the patient would say, oh, well, does it matter that I had my tonsils removed, right? Of course, we're asking about surgeries, but another thing might be, what if they said, well, I'm not sure if it matters or not, but my family has a history of cancer, right? That's important because maybe they're having this lower back pain, and maybe the patient's over the age of 50 and they have a history of cancer in their family. Well, we know that, and actually, I'm going to go a little bit conspiracy theory on you, but we do know that cancer is not a hereditary condition. I mean, there are some exceptions to that, but by and large, cancer is not a result of your genes. Cancer is a result of some missing aspect of your health, right? It's some health impact that's causing cancer cells to develop. So even if somebody has a family history of cancer, in my opinion, unless it's one of those really rare cases where it's a genetic situation, in most cases, they're not destined to repeat that if they change the lifestyle cycles that their family has instilled in them. Okay, so here's an example of that. And again, not to get too far into conspiracy stuff, but how about if your patient says, I have a history of colon cancer? Well, colon cancer is definitely not a hereditary condition. Colon cancer is a product of your nutrition and dietary habits. So if somebody has a family history of colon cancer, doctors, it's really important for us to start teaching that patient about nutritional considerations so they don't repeat the same process that their family has had for generations, right? So, and we can do that, and that can change that cycle for our patient. Okay. Anyway, so no, you've covered everything. Ask about surgeries, medication, or anything else. If you had any surgeries, for example, tonsils, wisdom teeth, appendix. Now I'm listing some lesser known surgeries or less common surgeries just because I want the patient to really think about anything. Because I might say, have you had any surgeries? No. How about wisdom teeth? Well, yeah, everybody gets that. Well, that's a surgery. How about tonsils? Well, yeah, my parents had tonsil surgery. Yeah, but that's a surgery. How about colon surgery? Have you ever had colon surgery? Well, yeah, I had part of my colon taken out, but my family has a family history of colon cancer, right? So you see where I'm going with that? So we want to, even though they might seem a little more redundant, we still want to ask about these things because it gives us an opportunity to help our patients from a more global aspect through enhanced nervous system function and being subluxation free. Okay. Are you currently taking any medication or for a chronic condition, for example, even aspirin, Tylenol, allergy pills, blood pressure, thyroid, or sleeping meds? Again, subtle things that they may not consider as relevant, but they are relevant. And they're also especially important because it may be that down the road, they don't have to take them anymore. And we want chiropractic to get the credit for that. I take Tylenol approximately 3 times a week. Wow, the pain might even be worse without Tylenol. Oh, you're right. I can't even imagine that. Well, with everything you've shared with me, is there anything I've overlooked that you feel I should know? No, that's everything. And there's even more going wrong than I realized. Thank you for sharing these details with me. It sounds like you have a subluxation, but the doctor will be in shortly to find out. If any additional tests are needed, I'll return to help with that. Okay, thanks. The CA leaves the room and leaves the file for the doctor. Now, of course, there's that little comment. If there's any additional tests that are needed, I'll be back to help with that. Well, if you think about when you go to just a standard medical office, there's a medical assistant that comes in before the doctor and does the vitals. Because of the way that that's done, many times those tests seem pretty mundane. They're just routine tests. Everybody gets them, no big deal. But what if we were to put the consultation first and then a parting comment like the one I just read you, where if there's more tests needed, the doctor will send me in to do those. Now those additional tests, which might have seemed a little more mundane, now they're significantly more relevant. Now, and that's the case with things like range of motion, orthopedic tests. They become much more significant in the eyes of the patient They're obviously significant for the doctor because we base our analysis on that, but they become much more significant in the eyes of the patient when they're directly ordered by the doctor as a result of the doctor's examination. So I'll show you how that ties in together next week when we get into the DC exam. That'll be our next section. Okay, so let's go back over and we'll wrap up, because next up we have the consultation details. This is the sample. Now, I've shown you basically through the process of our whole series so far how to fill in this form, which I had named at the top primary concern sample on this page, but typically it's called the consultation details on the website. But this is just separating out that one sample or that one section where we're going to fill in those primary concerns. So we would fill that in using here I spelled it out, but in the abbreviations, which is on if you look at the form on the website, it's called the related symptoms. At the bottom of that, it has the abbreviations. And my team relies on those heavily because that's what they use to quickly write down their notes during the consultation. But the lower back pain could be LBP, for example, and it just goes on from there. But these are the primary concerns on that form. It's just this one section. And then you would then write down, actually, I should have added that on here because this is the bottom section that you would add to that and fill that in accordingly. So it's this bottom part here that you would fill in as that third part of written notes. And that wraps it up. So those are our sections. Just want to remind everybody, please don't forget to put in your results into the goals tracking system because it's going to show how you're doing towards your goals for the success rate. So we have our new patient success rate, report of findings success rate, patient visit success rate, our care plan renewals, and at the bottom is our revenue success rate. So those are all there for you. Please go in and put your information in, and you just do that through the calendar here. Just want to remind everyone to keep those up to date because at the end of the year, we're going to have our DC and CA of the Year awards. So we'll be recognizing those doctors that are excelling with their goals. But that just gets plugged in here, and you just plug those in accordingly. Now, I'll just add another piece, and this is actually one of our questions. So one of our members emailed in where do I input the numbers on the calendar? Okay, and actually this was a great question I felt from this doctor because the doctor was asking, where do I put in the numbers, which I'm showing you here, but also where do I put in the goals? So it's important to strategically plan your goals at least on a quarterly basis, and you would put that in here. So you'll pick the quarter that we're in, right? So we're now in quarter 2 of the year, and you would put in your goals for new patients, patient visits, and revenue. And from there, then that's your goals. And then you boil it down by the day. That's where you put in your results. Okay. And it's going to think through here for a minute. So I won't go into more detail on that, but this is where you put in your results. That's where you put in your, and your goals are already in there. Actually, I'll just open this back up just to show you, because here it says our goals on this particular day. It says goal of new patients was 2. The result was actually 0. So that's not a good result on that day. Yes, my practice has ups and downs, just like we all do. That's okay. But if I'm either the PDC or the PDC is the only one who can change the goals. That was part of that question that came in. And the reason for that is I just don't want to have CAs going in and changing goals for the whole practice. They can put in their results, but I don't want to have them changing the goals of the practice without approval by the PDC, the primary doctor of chiropractic, which means the PDC is the one that needs to change the goals. So when I log in as the PDC, it will give me the option here to change those goals. So I'm not going to change it now, but that's how that works. So we would put those numbers in here, and then from there, it will show you your success rate reports in terms of how you're doing and how you're progressing towards your goals. Okay, so just wanted to share that with you. And I hope you've enjoyed our time together today. I know I have. It's always great to be with you. And I will talk to you next week. Thanks again.
If you would like to become a member of DC Trainings, be sure to head on over to dctrainings.com to get started today.